The thought of beginning fertility treatments may be a little overwhelming to some first time patients and could even cause a little bit of anxiety. So, the doctors and the staff here at HRC Fertility Pasadena want you to know what to expect from your first consultation with your reproductive specialist and your nurse coordinator. So, joining me today is Teresa Fontanilla, a registered nurse for Dr. John Wilcox's team. And it's so great to see you. Hi, Teresa. How you doing?
Good, Julie. How are you?
I'm good, thank you. Let's start by having you walk us through what a typical first consultation would be like in the office.
Sure. Typical consultation will usually last about 60 minutes or an hour or so. The couple first meets with the doctor. Doctor goes over medical background and medical history. Once he's done with the interview process, then he will bring him back in the back office and he will do something called a transvaginal ultrasound. This basically allows him to look inside the uterus and also the ovaries, gives him an overall view, or what we call baseline. Once that's done, then he meets with them again in the conference room and puts together what we call a treatment plan. When the treatment plan is in place, then the nurse coordinator then meets with the couple.
And tell me more about that. You are one of the nurse coordinators, a registered nurse, and so you will be meeting separately with the couple. What happens in that meeting that's different than what would happen when they were meeting with the doctor?
Sure. Most of the time when I meet with them, I try to be more specific as to what guidelines and what treatment plan includes. There's a list of diagnostic testings required when the couple is about to undergo treatment plan before they actually even start anything. One of them is what we call the ovarian assessment. This is an ovarian assessment report, which overall gives us an understanding of what the ovarian function of the female will be. We also do what we call infectious disease screenings for couples undergoing either intrauterine insemination or in vitro fertilization. This is actually mandated by the state of California. Those testings such as HIV, hepatitis B, hepatitis C, those are all required before the couple even gets started.
And are there any other tests that the couple might expect that they would need to undergo during this whole process?
Absolutely. The other one is what we call uterine evaluation. Uterine evaluation basically gives us an overall view of what's inside the uterus. It rules out polyps, it rules out uterine fibroids, it rules out adhesions or scarring. This could be the reason why they're not getting pregnant.
At some point during treatment, and it's not the same in every case, and every patient, every couple is different, but there might be some medications needed. Would there be training with the staff if you needed some sort of injections or medications along the way?
Absolutely. With either intrauterine insemination or in vitro, there is what we call injectable medications. We usually go over what we call injection teaching once the couple is ready to proceed and have already completed all of their diagnostic testing and they're actually ready to start the actual cycle.
Can you give me a typical amount of time it might take from the beginning of the process when they have this first consult all the way through to when they would begin seeing their OBGYN?
Yes, from the time they initiate consult to the time they're actually maybe moving on to their OB could vary depending on the type of cycle that they're actually doing. If a couple is lucky enough to where maybe only 1 or 2 cycle is completed and they get pregnant with that, then I would say maybe 6 weeks, maybe less.
And give us an idea of what the surroundings would be like when they come in, what the office is like, where they'll meet with the doctor, and where they'll be meeting with you.
Absolutely. So when they are ready to start and proceed with treatment, they come in. Each time that they come in, they check into our lobby. Most of the visits will require what we call blood tests because this is how we monitor their progress in terms of how they are responding to the medications that we are giving them. So each time they'll probably go to our phlebotomy section to where they get their blood drawn. Results are usually available in the same day. So by the afternoon, they're getting those results and they're getting a call back from one of our nurses in our nursing team to let them know if there's any changes the doctor wants them to make. From after their ultrasound visit with the doctor and their blood test, again, they meet with the nurse, get their next appointment scheduled, and then come back as necessary.
Teresa, so great talking to you today. You've really helped me, and I know everyone, understand exactly what that initial consult is like, so I really appreciate that.
Great, my pleasure.
And for those watching, if you would like more information about fertility treatments, you can go to the website, which is hrcpasadena.com. Thanks so much for watching.